Mrs. Smith. Doctor ordered a Foley catheter insertion for you. So I made sure with your EMR and your electronic health record that the order was actually there and that everything was for you. Is that okay that I insert a Foley? Okay, great. I'm gonna start with hand hygiene and get some gloves on before I verify some information. All right. And I've closed the curtain for your privacy, and all of my supplies is here. All right, I'm gonna go ahead and verify your first and last name and date of birth with your armband. Thank you so much, I appreciate it. I'm gonna raise the bed to a working height. All right, perfect. So I'm gonna start with some peri-care, Mrs. Smith, if that's okay with you. I'm just gonna cover you up with a bath blanket and then only expose the area that I need. I'm gonna go ahead and bring this all the way down to the end of the bed. So I'm gonna go ahead and raise up your gown. There we go. And I'm gonna ask that you raise your legs up for me. Thank you. Thank you very much. Okay. I'm gonna lower this really quickly. Alright. So I have all of my supplies here. I'm gonna go ahead and put a chuck pad down. Just to catch any water with your bottom. Alright. Warm peri-care. Warm soapy wash rag. I'm gonna start with the outer portion away from me, inwards with a different side of the towel, and with a different side of the towel, the inner portion, and then put this with the dirty laundry. And I have a wet wash rag with rinse water, same thing, one side with the outer, a clean side with the inner portion, and then another clean side for the inner part into the dirty laundry first. Go ahead and dry off the area as well with one side outer, a clean side inner, and another clean side in the middle. All right, doing okay, Mrs. Smith? Good. I'm just gonna go ahead and remove my gloves and we'll get started with the Foley catheter. Hand hygiene. Move my package. I'm going to be using this, so I'm going to place this at the foot of the bed. All right. In a perfect world, this would be a perfectly packaged situation. Away from me, side, side, closest to me, holding similar sides. Very good. Pinch, grab, and then over here. All right. Two. Pinch. Place. There we go. All right. So I'm gonna go ahead and get rid of this because we don't need it. Going to shiny side down, airplane it. And doing okay? All right. Are you allergic to any iodine or latex? I would ask this before touching the patient or anything. You're allergic to iodine. Get rid of that. And then I'm going to get rid of this. We're going to be using the hydrogen peroxide. Fix up my cotton balls. Place my lubricating jelly. And then get rid of any other items that I don't need. So now I'm going to go ahead and remove the packaging or the sheath of my I'm going to place this into the lubricating jelly. So I'm going to place this onto the Foley. Okay. All right, Mrs. Smith, I'm about to get started. First, I'm going to clean the area, and then I'll let you know when I'm ready to insert the Foley. Okay. So now I'm going to hold open the vagina, and then I'm going to start with the outer one, closest to me. And there. Done. All right. I'm going to take my lubricated. All right, Mrs. Smith, I want you to take a deep breath. It might be a little uncomfortable, okay? I'm going to count to 3, 1, 2. It'll be a lot easier. Get in there. Which one are we putting it in? All right. In a perfect world, this would be going in because it's lubricated. And I would not let go of the patient's Miss Smith, I'm trying my best, okay? We're gonna try to get it in there, I promise. Okay. Any way that we can. There we go. Okay. Anywhere we can. I'm sorry, Mrs. Smith. Okay. So in the real world, it would be lubricated and it would insert all the way in, but for time purposes, because it's not working, we're gonna try to just force it, but my hands would not be touching anywhere near there. I would inject the 10 mLs of saline. Okay, it's not gonna go in because, like I said, it's not in there. I would check to see if it's secure. Once I let go, I cannot touch the patient again. I would remove the syringe and I would hang the bag down on the side of the bed. I would collect a urine sample. I would clean up my mess. I would also anchor this with a strap, which all of them are in use. So I would anchor the strap and I would anchor it here to secure it there. And I would secure it in the inner thigh like that. I'm going to go ahead and get rid of my items. All right. Toss that away. And in a real world, I would cover the patient up and then lower the bed in the lowest position and raise up all the side rails. But for time's sake, I'm not going to do that. I would return, check the record. Time to take the Foley out, Mrs. Smith, if that's okay. I would repeat all the steps and up until here. Place a Chuck's pad down, which I already have. Okay. I would move the bag up, have a clean syringe, attach it. I would let gravity do its thing to fill up the tube. And then once it's all the way full, I would instruct the patient to take a deep breath, coil into the hands, and then get rid of all of my supplies. Obviously, I would have began all that with hand hygiene and changing my gloves, but I'll put it in the garbage. All right, Mrs. Smith, while I'm here, can I give you any peri-care? Alrighty, thank you so much. You said no, you'll do it yourself. Okay, I'm gonna go ahead and relax your legs. Cover you up. Sorry for all the difficulty, Mrs. Smith. Thank you for being a good sport. Oops, sorry, I got your face there. I will put this in the dirty linen. Raise the side rail. Bed is in the lowest position. Call light is in place. The wheels are locked. Is there anything else I can do for you? Alrighty. Remove gloves and hand hygiene.